Okay, so welcome everyone. I think most of you know who I am, but my name is Camilla Penney and I'm a Junior Research Fellow in Earth Sciences at Queen's. And I'm very excited to be chairing the second session of the Cambridge Disaster Research Network. The idea of today's session is to look at disasters from the perspective of saving lives. So I guess an intuitive definition of what a disaster is involves mass casualties. And there's some aspect of that that might be controlled by the scale of the hazard, but there are also many other factors which play a role in controlling the loss of life in disasters. So today's speakers are very broadly linked by an interest in reducing and understanding the number of casualties which might occur in disasters and how we can reduce or prevent loss of life. So just to give you a quick outline before we start, each of our speakers is going to give a short presentation about their work and perspectives on this topic. And then the idea is that we'll hopefully have quite a lot of time for discussion to hear different people's perspectives and to get some interaction amongst the panelists as well before we kind of sum up at the end. So first of all, I'm delighted to welcome Dr. Josh Macabuag. Josh is a chartered structural engineer with a background in catastrophe risk modelling, and he currently works as a consultant to the World Bank and the reinsurance sector. He also works as a search and rescue engineer for the NGO SARAID, and I think that that is likely to be the main topic of his talk today. So without further ado, Josh, over to you.
Sure. Share my screen. You can hear me okay? And can you see my screen? Is that yes to both? Is it okay? I'll continue and assume it's a yes. Okay, so I think as Camilla said, the most interesting part is the discussion, right? So I've got a fair few slides here, but don't be alarmed if I just skip over them or don't really go into detail on what's on the slides. You're welcome to the slides afterwards or to ask anything about them afterwards. So. As for me, I'm a structural engineer by background and by profession. So I'm a chartered engineer. So I used to work in building design for a number of different companies in a number of different countries. I went to the Japan tsunami with the earthquake engineering field investigation team of the IStrucT, the Institute of Structural Engineers. Found it interesting, did a PhD in building damage predictions for earthquakes and tsunamis at UCL. That was sponsored by the insurance sector. I then went to work in the insurance sector for 2 years and then in catastrophe risk modeling. So very much what the second presentation is about. And then now I'm an independent consultant working mostly working in what I call disaster risk engineering. So it's essentially 3 facets, and that's the disaster disaster response, which is the search and rescue aspect of what I've been doing the last few years, which I'll talk about mostly in this presentation. Also risk modeling, catastrophe risk modeling, which is calculating the frequency and severity of disasters to inform decision making to reduce the impacts of those disasters. And then structural engineering. In this case, in this context, I'll be talking a little bit about damage assessments and the procedures and processes in place there. Also, I should say that my interest in, I have a keen interest in the network, and I really thank Camilla and Hannah for inviting me, because there's a lot of areas of research, of discussion, of overlap with the various skills, and there's a lot of opportunity for collaboration, both with SARAID or with me and my facets at the World Bank or in other CAPs as well. So very much, if anything piques your interest, and we don't have time to talk about it today, get in touch, because we're very much looking to continue the relationship. This one is a little bit of context. So I'm sure you're all very familiar with the disaster management cycle. There are lots of different versions of it. You Google it, you'll get 10, 20 different images. I like this one. 4 simple stages: response, recovery, mitigation, preparation. Just to say that whenever there's a disaster, especially a natural disaster, then you can there'll be a recurrence associated with that disaster, which means it'll happen again. Which means that you have the opportunity first to respond to it, but then to think about the next disaster. And my case, one part of my introduction that I skipped over was that alongside my professional life, I've been volunteering as a search and rescue engineer for a while with the charity SARAID. which is a UK NGO, Urban Search and Rescue, which I'll explain what that is in a second. And it stands for Search and Rescue Assistance in Disasters. And I'll give you some case studies of some of the things that we've done as an organisation recently. And that's obviously focusing the response phase, that immediate response on the same day, next day, getting on a plane and trying to be of use. And then perhaps more importantly, I'd quite like to focus on the next stages, particularly recovery from my case, but then the presentations to follow, I think we'll look more at some of these other stages. So it's very much a holistic view, although I'll be zooming into the response and recovery. So for anyone that's not familiar with urban search and rescue, it's distinct from lowland and highland rescue. Urban search and rescue is essentially finding and extricating casualties in collapsed buildings. In our context, that'll be mostly for overseas earthquakes, earthquakes and other disasters, which we deploy to. The main kind of facets of the work is that you have to find the casualty. So you have to find out who's alive and where they are. You then need to think about making the building as safe as possible. Safe is a word you should never really use in this context. It's never going to be safe, but as least unsafe as possible by shoring and stabilizing the structure where possible. Then to get to the casualty, you'll be lifting and shifting heavy items to get to them, breaching and breaking through walls and floors as needed. Rope work would be anywhere from operating a full working at height system to just lowering casualties over unstable ground, etc. And then you obviously have the casualty extraction, which would involve your basic first aids to stabilize the casualty and get them out to more competent, more dedicated medical resource. And where do engineers sit? I heard there were some people that would refer to themselves as engineers here, but I think for anybody, there's a lot of interaction of lots of different professions with this field. So don't think I'm just focusing on engineering because it's all I care about. It's just the focus of this presentation, but there's lots of interaction. Engineers specifically, it's about advising the rescue leader, so the person making the decision of, yes, we'll send our friends and colleagues into this collapsed building, to advise them on the least dangerous way to access and egress the casualty. So that means identifying the significant risks, assessing them, and advising or devising and monitoring the way to avoid, remove, mitigate, and monitor each of those significant risks. One item of research and work that we've done recently, I mean, it's not necessarily research, but I've kind of turned it into that, was that I'm an instructor on the search and rescue engineering course through what's called INSARAG, or associated with teams from INSARAG, INSARAG being the International Search and Rescue Advisory Group, which is an umbrella organization in the UN for international search and rescue teams. And one thing that's kind of lacking is that, USAR engineering is a kind of newly defined field, which might sound strange. You think working on collapsed buildings would be very much a kind of remit of engineering, but really it's mostly led by rescuers, fire service, military. Engagement with engineers has been a bit, historically a little bit ad hoc, as to if you have someone available, great, otherwise just play it by ear. Whereas now the INSARAG guidance is starting to take on board engineers in a bit more serious way, but the guidance is very rudimentary. So as part of this training course that we've done, which is on I'll explain it another time, but it's in a town in Sicily that was destroyed in the 1960s by an earthquake. So we basically have a week to run around this town doing engineering scenarios on actually collapsed buildings. And one of the key outputs of that was this guidance note to define what are the key processes that structural engineers should carry out before, during, and after deployments. And there's lots of flowcharts in there, as you can imagine, of any document produced by and for engineers. And this is one of them that's a bit more high level. So where you have a disaster, everyone can see the engineering role of looking at the building and doing what I said before, right? Devising the least dangerous way to access and egress the victim. But actually, the engineering role is much broader than that, right? So for one example is that to have any kind of effect on the casualties that are in trapped buildings, you have to be in front of the correct buildings, right? Which means that you need to actually be part of a much larger coordination and assessment process. There's a lot that goes into that, which you won't have time to go into, but you have everything from remote sensing to coordination of boots on the ground, and so on and so forth. And the engineer's role there is there's a big role there. And this phase 5 at the bottom right hand corner is beyond the rubble. So that's basically after you've finished with the search and rescue. Traditionally teams would then go home, and then the next phase would start, the kind of recovery phase. But I'll give you some examples of where that's perhaps not effective, and it's much better to use the opportunities of the skill sets that are in country anyway for the rescue. And that's a particular pet passion of mine. The Nepal earthquake is one example. So 2015, a large earthquake near Kathmandu, the capital, just over 8,500 casualties, large number of collapsed buildings. For anyone that's actually interested in finding out a bit more about joining SARAID, I'd be happy to explain that as well. But as this example, we get a text message saying that we need to deploy, so we get our stuff together and we go to the airport, and then we make our deployment. We do our deployment, and in a nutshell, the deployment was a number of days of receiving taskings from the local emergency management authority, which was the Nepalese military in this case. I don't know if anyone on the call was in Nepal. I'd be interested to hear from you. And yeah, basically just going and assessing buildings for whether or not there were live people in them that could be rescued. This building on top is one, in the top left is one that was my photo of a 5 or 6 story building that had, I don't have time to go into it, but you're actually looking at the ceilings. So you're looking at the underside of all of the slabs of this building. So it started, I don't know if you can see my mouse, but it started on the left-hand side over here and toppled this way onto a playground. So, when you look at it, you think it fell that way, but it didn't. It fell the other way, and they all sheared and they're on their underside. So it's just an example of the type of collapses and buildings that we have to look at. But that's the end of the USAR bit. But the damage assessment bit is something that, in terms of saving lives, then the image that people have is of people in orange coats running around and pulling people out of rubble, right? But the reality is that the vast majority of people that are rescued and saved are saved by first responders. So your passers-by, your neighbours, and then local emergency services if they're operational. And you have the international rescue, and that definitely serves an important purpose for the people that are rescued there. But then there's also this. In this case, I've highlighted 2.8 million people displaced, hospitals that were damaged, a lot of other problems basically as well. And somewhere on there, you've got, if you can see my mouse here, nearly 2,000 rescue and medical personnel. This would just be the numbers that are registered through the base of operations, officially through the UN system. There'll be plenty of others in country on a kind of less official bilateral basis as well. And you see lots of images. You see lots of images like this on the top right, which is shoring. So shoring. So shoring is basically trying to take temporary stabilization of a building. Spoiler, it's not supposed to look like that. The 2,000, the nearly 2,000 rescuers that are in the base of operations, literally a kilometre from this photo, they all know how to do a really good shore and a really good system of shoring. But the vast majority of them went home as soon as the government said end of USAR, and people are doing this. And I know this remained for a number of months. I wouldn't be surprised if you still see images like this around Kathmandu. So the point is that there's this beyond the rubble's need. There's a lot of skills of all the engineers and other people that are in country. How can we use them? And damage assessment is one of that bullet point list that I had in the top left. So these are some examples of damage assessments in Nepal. This top left image is the inside of a 3-story adobe home. I remember this one because I had to tell the family, or the multiple families, that they couldn't live in their home anymore because there wasn't really any way to save this. This bottom right-hand image is of a hospital, of the patients sleeping and living outside the hospital because they weren't sure if they could go back inside. And here the outcome was that we could assess the building and tell them that they could go back inside, just with certain restrictions on certain areas, etc. So as we were leaving, people were packing up to go back into the hospital. So assessments, they're an important part of the whole of the machinery that gets people back to their lives again after they've lost their livelihoods and potentially loved ones. And it might sound like a stretch from saving lives, but actually the interlink between people's livelihoods, the effect on the economy, all of the issues of people living in temporary accommodation for months and so on, that all has a very serious toll, and it can very directly relate to following disasters as well. So Albania is an example where in last year, 2019, there were 2 earthquakes, September and November. So luckily, September wasn't as large, but it was very much the case that those that were affected in September were still in the same state of having been affected when the next earthquake happened. And the point is that looking at a building isn't just about deciding whether or not it's safe, but it actually has lots of kind of broader political and economic ramifications of compensation, of requesting international funding, and so on and so forth. So you have all these skilled people from USAR teams in country. They tend to go home after the search and rescue is finished. You have all these needs, a lot of which can be met by them. And so the task then is to kind of marry them together. And I think this is where I need to start skipping through slides. But the point is that in Albania, there were a lot of challenges in the assessment processes that were in place. So our role, not through SARAID, actually, this was through something called the EU Civil Protection Mechanism. And our role there was to work with the authorities to define a better system of damage assessment. And that system of damage assessment has a number of different components and facets. But the point is that when all those different components and facets work in tandem, then you have a system that works for people's life safety through to getting people back into their homes or getting people out of unsafe homes, allowing them to communicate competently with the international community in terms of assistance, compensation, and so on and so forth. And a small part of that, but it's the part that is in media, is again all those bright vests and international engineers going and assessing buildings. But really, that's not the main point of that assistance in damage assessment coordination. The main point is helping the authorities set up their own long-term system for damage assessment coordination. Those international engineers are just there in the short term to help that get off to a good start. And you don't need to look at the content of this one, but just these 4 categories. I said there are a number of components of good damage assessment coordination, and that's these 4 here, as we've defined it. And that's your procedural processes. So what do people actually have to, how do people operate? Things like, are the police going and cordoning areas that you say to cordon afterwards, and so on and so forth. There's lots of examples on the screen. The actual technical building assessment, the bit that most people would understand of an engineer needs to know how to assess the building. The coordination of all those assessors, something that was often lacking, certainly in Nepal, for example, where you have hundreds of engineers assessing potentially thousands of buildings. If that's not coordinated effectively from the outset, you get a lot of wastage. People looking at the same buildings, going to the wrong places, it doesn't work. And the correct management of all of that data, again, if that's not in place, then you essentially have wasted your time and you have to go back and do it again. So with those 4 things in place, and that's when you have an effective system. And last 3 slides, I promise. Beirut explosion, fast forward to August this year, SARAID deployed to Beirut to assist the authorities of Beirut in their damage assessment coordination. Same thing, helping them set up their own long-term system of damage assessment coordination. These are those 4 components. We don't have time to go into them. But there are 2 things that they do. You assist the local government or local authorities, and you coordinate the international assessors, all those USAR search and rescue guys. As I said, are kind of potentially going home. You want to grab them before they go home and make use of them before it's too late. And there's a picture of our guys talking to other guys. And that's it. There you go. I think that was a bit long, but the point is that if you're interested in any of that work in terms of getting involved or chatting to me about how we can collaborate on research or anything else, then definitely get in touch. Yeah, that was the micro kind of focus on the immediate response in those first days. And then I think now we'll zoom out and have a look at a bit of the bigger picture and all those other stages in a disaster management cycle. There you go. That's me.
Thank you very much, Josh. That's great. Yeah, so our second speaker is Dr. Saki Yotsui, who is joining us very kindly from Japan, where it is something like 1 a.m. her time. And she has therefore very understandably decided to pre-record her talk. So I'll play it from my computer, but she is on the call, so we can also have a conversation with her afterwards as well. So hopefully this will work.
Good afternoon, everyone. My name is Saki Yotsui from Ritsumeikan University in Japan. Thank you so much for giving me this kind of opportunity. Today, I will explain my research topic and I would like to introduce natural disaster plan under COVID-19 in Japan. First of all, let me introduce myself. I finished my PhD at 2018 March. After that, I worked at the insurance broker as a catastrophe risk analyst for 2 years. Then I am researching at Ritsumeikan University now. As I said, my main research topic is disaster prevention, focused on fatality modeling or evacuation plan. This figure shows the number of the deaths and missing people for typhoon and flood, volcano, snow, earthquake and tsunami in Japan from 1993 to 2018. As you already know, 1995, we had the Great Hanshin no Awaji earthquake. In 2011, we had the Great East Japan earthquake and tsunami. At the same time, as you can see, typhoon and flood also happen every year, and we have a lot of victims as well. Moreover, Asia have a significant impact on the number of people killed and affected by earthquake. So why we need to research fatality modeling? First point, society should be aware of the risk that natural disaster pose in their locality and should have appropriate knowledge and mitigation plans in place. But how people know the risk? Fatality is one of the indexes that the nation and its society determine the risk of a natural disaster. Second point, each country or each region has different disasters, and there are differences in culture, risk perception, and human behavior. How to calculate the number of deaths? We need equation. That equation, which can take into account the characteristics of region, is needed. So based on 2 points, it is important to analyze the damage caused by natural disasters to develop models that can predict casualties under different scenarios. So in my PhD thesis, we created fatality model of tsunami disaster in Japan. Japanese government provided the equation before 2011. This equation looked at inundation depth and the population as parameters only. But fatality modeling is very important for development of disaster prevention plan. So we looked at elevation and the distance of evacuation route of fatality under the 2011 Great East Japan earthquake and tsunami. We provided new variables of fatality model. It is geographical trends calculated by analyzing elevation and distance of evacuation route. So we took into account tsunami characteristics, geographical features, and the demographic components. As you already know, around 20,000 people are victims in 2011 Great East Japan earthquake and tsunami. But because of the data availability to us, we used around 2,500 people as samples. The important thing is we use the death address to evaluate the elevation and a distance of evacuation route. We assumed that are hit by tsunami in their house. So how to extract the geographical information? We used GIS software to extract them. We pointed test address on the map, and we pointed escape points from inundated area. Then we did statistical processing to all information. Case study area. The earthquake hit off the coast of Tohoku in northeast Japan. So we are analyzed focusing on 8 cities in Iwate Prefecture and 4 cities in Fukushima Prefectures. These places are most severe damage. Then based on our result, new fatality model could evaluate deaths at the nation level, prefecture level, municipality level. So we can estimate the deaths for the future tsunami disaster if we figure out the elevation distribution and the population of the area we want to predict. And I summarize environment surrounding human society in the event and natural disaster. Understanding casualties allows us to know who is vulnerable and the vulnerability of the community or specific location. This figure is for tsunami only, but future it is necessary to investigate human damage caused by multi-hazards, not just the measures and assessment of a single disaster. And we need to think who handle the disaster prevention plan. And the important thing is each of us should think about own disaster preparedness plan as individuals and family. So last few slides, let me introduce the disaster prevention plan under COVID-19. In Japan, we will evacuate evacuation centers such as gymnastic, school, community center when disaster occurs. It is common knowledge for us. But now we face the below problems with traditional evacuation centers. These 3 pictures were taken during Kumamoto earthquake 2016. As you can see, physical distance to people might be close. The height of a partition is not enough. So now, government provide options to evacuate a large area, such as relative's house or hotel, or staying in a car in a tent temporarily. I would like to explain one example. One of the organizations created a new guideline for internal layout of inside of evacuation center. Left-hand side, this explains previous inside of evacuation center. Please look at blue line. 4 families with each family comprising of 4 individuals are staying next to each other. But now the organization rearranged the inside of evacuation center. So right-hand side, this explains new internal layout of evacuation center. Looking at the blue line, families are staying away from each other. So in other words, we need to recognize that the capacity of evacuation center will be less than before. This is guidelines for natural disasters under COVID-19. One of the researchers created the guideline for creation of countermeasures against flood disaster during a pandemic situation. And one of the organizations created the collection of critical situations during flood emergency response. So now, researchers, government, the local government took action to reduce the risk by COVID-19 and natural disaster. That brings me to the end of my presentation. Thank you so much for your kind attention.
Yeah, another very different perspective, and the multi-hazard thing is going to be a theme, I think. In fact, we're going to continue with a more epidemiological bent. So our final speaker is Dr. Freya Jephcott, who is a research associate in emerging infectious diseases, now at the Cambridge Centre for Existential Risk. And Freya's background is in both the sociological and the biological aspects of disease, which is something that I'm sure many of you will realise as being extremely relevant to our current predicament. So Freya, if you'd like to share your thoughts.
I'll unmute myself and I'll quickly bring up my slides. There we go. So, as Camilla said, my name is Freya, and normally what I do is research into outbreaks of unknown origin. So when you have a large outbreak, but you can't work out what the causative agent is. And I tend to study the public health systems we create to manage these situations and look through a sort of anthropological lens to try and understand why we often actually mismanage these situations, which again has become quite relevant recently. In addition to my research, I work intermittently for the World Health Organization doing policy work on the management of outbreaks of unknown origin, which again is all probably being rewritten at present, but is mildly relevant. And I also intermittently work as a manager of epidemiological activities for Doctors Without Borders, so Médecins Sans Frontières, managing outbreaks in complex settings like refugee camps or in the jungle in the DRC. A sort of mix of unknown origins and then Ebola, which comes up a lot. I was so excited about this theme for this talk. This seems to come up in so much of my sort of work, saving lives, sort of thinking about the decisions we make about imagined future lives versus current suffering and lives saved. And the idea in public health, these kind of huge assumptions we have, like the fungibility of human lives, that we're all exchangeable, which in a very lived way is maybe not the case. But I decided for this talk, because I did kind of feel it was a bit relevant to what's going on with COVID at the moment, I'd look at the platform that us researchers have in establishing narratives about saving lives, and how maybe we need to sort of occasionally reflect on and deconstruct these to kind of see the disciplinary biases and sometimes the demographic or geographic biases that come in that maybe stop us attending to saving lives more efficiently. So I realize that's a lot of stuff to just sort of throw in there. So I'm going to try and use two quite short illustrative stories to get there. The first one is the 2014 West African Ebola outbreak. So at the time I was with MSF and I was a manager of epidemiological activities in this very hard hit part of Sierra Leone. So essentially I was providing advice to the local health authorities, which gives you a pretty good vantage point for seeing the whole response and how it's working together. Now, I know that everybody's wondering, how do you manage an Ebola outbreak? Well, it is actually very, very, very simple. You find anyone that looks to be sick, so that has fever or vomiting or diarrhea, and you move them away from the seemingly healthy people. Honestly, that's about it. Someone looks sick, you get them away from everybody else, and you keep an eye on the people they had contact with. Ebola is very handy like that, in that it's not till you're quite symptomatic that you're infectious. So that's why the contact tracing is so effective. You can also do things like burying bodies carefully so you don't get contaminated from the bodies. And in a cinch, that is all it is. Now, to do this safely and efficiently and effectively, you need local public health officials. So in Sierra Leone, it was district disease control officers. They're members of the community that manage all kinds of sort of public health issues. Because they have the relationship and the sort of chains of communication with the local community, and they just have a good sense of what's going on. They're also predictably the first people to get Ebola in these situations because they're managing these people. All they need, essentially, gloves, masks, and access to the communities. Now, whilst the sort of basic system of managing outbreaks, sick people away from healthy people, hasn't changed, we have actually got more tools over the last couple of decades to help perform this. So we now have diagnostic tests. So if you have a fever and I separate you, we can get you tested and we can see if you don't have Ebola back home. If you do, then sort of stay with us. And during the West African Ebola outbreak, we also ended up having some high throughput sequencing labs around, including one from Cambridge, or maybe a couple. And they kind of helped in that you get the sample, you look at the sequence, and you could tell if someone had got sick from a case you already knew about, or if they'd, like, the sequence is very different from the ones you've seen and you've missed a massive chain of transmission and you need to kind of go panic stations. So it's helpful, but in the end, it's just sort of feeding the same system. Since then, though, we have ended up with some effective treatments for Ebola, which we didn't have before, and they help with incentivizing people to be isolated, because now we can actually offer treatment and we're not just taking your sick child away to die. We also now have vaccines. And so when we're doing this, you're sick, come with us, you touch someone who's sick, we need to keep an eye on you. We can actually go for all the contacts of those contacts and vaccinate them, and try and do this sort of ring vaccination approach, which is also very helpful. Back then, though, we just had the sort of lab testing. Now, the thing is, at the end of this outbreak, there were all of these lesson learned events. So I went to several when I got back to the UK, including with sort of House of Lords, Wellcome Trust. I'm sure I'm forgetting some, but there was something that sort of struck me, is you'd have these prominent, typically British participants in the response. Quite often they'd like headed these high throughput labs or done something sort of epidemiological. And they would talk about how they saved lives, like how the response happened. And because they were the person telling the story, it tended to focus around what they did. So it would be about the sequencing lab and how this helped us find those missing chains and saved lives. Not once, not in a single talk, in a single one of these lesson learned events, did I hear anyone mention district disease control officers, those people that did all of the finding the cases and isolating them, the people that got sick because they didn't have gloves or who struggled to find cases because the roads just weren't there. If anyone did sort of mention these issues of no PPE, or the fact that there's no plumbing there, or the lack of doctors, or the problems with the roads, it was as a sort of background accessory to their story of them doing their very particular, typically quite techie intervention. Predictably, when I was back in West Africa the following year, there were a lot of these sort of high-tech mobile labs in the pipeline, a lot more sequencing labs going on. There was a lot of funds from the CDC being made available to do sort of zoonotic laboratory work, essentially in areas without roads or plumbing. And when you do talk to district disease control officers about what they would quite like funding for, they would almost always tell you that it was for teen pregnancy, which just shot up during Ebola. But I mean, this is true in a lot of places, like if you ask in parts of Ghana, it'll be resources for addressing teen pregnancy, it'll be complaints about the roads, and it will be about things to attend to malaria, especially where cases go up despite bed nets and such. Now, the thing is, any epidemiologist worth their salt will tell you proximity to a paved road is one of the greatest indicators of formal healthcare utilization. And formal healthcare settings, sort of hospitals and clinics, all of our surveillance systems depend on these things. So that's quite huge. And Epi will also tell you that maternal education level is a really strong indicator for protection against like all infectious diseases. So taking care of teen pregnancy and making sure that young women are in school is hugely important in terms of like general public health gains. With malaria, so other febrile illnesses, especially ones that they haven't got the diagnostics for or the treatments for, things that are quite common like malaria, are what hides so many emerging infectious disease events. Finally, I just want to say this: you do not need to know an Ebola outbreak is Ebola to be able to attend to it effectively. We get so focused on sort of these techie diagnostics and such, where basic infrastructure will really deal with most of this. Now, the second story I'm going to go a bit broader with, but it's the same kind of gist, so bear with me. Emerging infectious diseases in general, and where in the causal chain we save the most lives. Now, to tell this story, it's a very brief history of emerging infectious diseases. And whilst I realize emerging diseases have been emerging as long as there's been people, and before then, in fact, the sort of term, the category in public health is relatively new. It came about in the 1980s, the late 1980s, where we'd suddenly seen the global spread of HIV and everyone's surprised by a giant AIDS epidemic. And we realized that actually there's a lot of infectious diseases suddenly emerging, and this thing we thought we had under control is definitely not under control. if anything, the situation's getting worse. So we started out on the right foot. In 1989, at this National Institute of Health conference, Stephen Morse, who was chairing it, said, look, the reason that we've got suddenly all these emerging infectious diseases is ecological disruption, deforestation, high density animal farming, global travel, growing populations, especially moving into dense cities, malnutrition. These are the things that are forcing it. So the kinds of people who we need to really help bring in to address it are going to be everything from ecologists to demographers, political scientists, lawyers, agriculture. These are the people that need to address this. Unfortunately, very, very quickly, we kind of got into our old, not very helpful habits. Joshua Lederberg, a Nobel laureate microbiologist, ended up sort of creating a lot of, or heading a lot of the big documents then that sort of set the agenda for tackling emerging infectious diseases. And in short, he essentially went, nah, look, what we need, more biomedical research, more surveillance, especially in poorer areas of lower latitudes where disease tend to emerge. And we need more investment in novel treatments and sort of tech. Now, the thing is, as you can see from that slide, that's a lot further down the sort of causal chain. That's a very much sort of reactive response. And we see this a lot in public health. If you look at the international health regulations, the sort of big quasi-legal tool that's meant to help us globally tackle these things, it's all reactive. It's all once the horse has bolted. Now, the thing is, I will read this wall of text because I know that's, you know, a cardinal sin in presentations. But the thing is that this was actually a really conscious choice. There was a sort of dichotomy invented. And so I'll just read this quote from Joshua Lederberg. One line of social thought would argue that the only answer to emerging infectious diseases is a fundamental convergence on population and poverty. Even were the will to do so to exist, and that needs every encouragement, the history of social experiment in the 20th century would leave one in despair. Health is also a precondition to economic development, so that our more selfishly motivated measures can be of great benefit to the overall human condition. Now, I know that that seems quite benign, but this essentially became the consensus in emerging infectious disease work, especially this kind of perspective that comes from very much privileged countries, not where the diseases and endemic issues exist, but where there's a threat of emergence to them. So surveillance and response kind of, that takes care of it for us. But it also shows a very strong disciplinary bias, sort of to a man with a hammer, everything is a nail. I mean, he's brilliant microbiologist. He's not the right person to talk about addressing the drivers of emerging infectious diseases, but as a prominent microbiologist, he sets the overall agenda in public health and a lot of the discourse and narratives. I mean, I don't think I have to say much about why it's inefficient to try and save lives that far down the causal chain rather than addressing the drivers, but just to really hammer home that point, a lot of the drivers of disease emergence are the things that are driving a lot of the big catastrophes that are coming our way. I know I shouldn't say this on the record, but this outbreak, this current COVID situation, I mean, that's really small fries to what's headed our way. The same sort of drivers of disease emergence are the drivers of climate change, of pollution, and pollution is really a massive killer. Sorry, just quick tangent. 9 million premature deaths every year. It's 3 times the amount of deaths of TB, malaria, and AIDS put together. These are huge problems and they have the same drivers. So efficiency says we should really be addressing these drivers. Now, okay, so I would go a step further, by the way, in sort of talking about this and say that we also need to examine some of the things that have let these drivers get out of hand. I won't go into depth because I know this is where I really lose people, but free market capitalism, unchecked post-colonial legacies, failures of global collaboration, a lot of this is kind of what underlies the situation we're in now. But like I said, I will abandon that because I know that's where I leave people. Finally, before I do end, I realized there was a note saying that we should look at the question of lives versus other things, which has come up a lot with COVID, the economy versus lockdown to save lives and all the rest. And I guess in short, quickly attending to that, I think it's a completely made up dichotomy. I mean, putting aside the fact that without healthy people, you don't have an economy. You could just already see with COVID that the countries that put resources in very rapidly to control the disease early are doing better in sort of predicted GDP losses. Attending to public health and attending to the drivers of disease is never going to be the wrong idea. I don't know how we ended up in this situation. I suspect it was during the 80s and 90s, and we went for this more utilitarian reductionist economic models of disaster. But we really have to stop falling for this idea that we're working with lifeboat ethics all the time, that we only have this tiny finite amount of resources to sort of address these huge fundamental needs of society with. I mean, I think a lot of the time it's this weird fantasy we've somehow internalized because other people have other things they want attended to that are not quite so important. Anyway, that is my very rushed sort of summary of saving lives. Please feel free to heckle or bring questions.